Short-acting reversible birth control. The pill. Common brand names for the pill are Yaz, Yasmin, Seasonale, Micronor, and Loestrin. How it works. The hormones in the pills, which include estrogen and progesterone, make your body think it is pregnant so your ovaries do not release eggs that sperm can fertilize to create a pregnancy. As a result of the hormones in the pill, the tubes connecting the ovaries to the womb grow slower than normal, so eggs cannot get to the womb to be fertilized. The progesterone in the pills prevents the lining of the uterus from becoming thick enough to allow eggs to grow in it. Finally, the mucus from the neck of the womb, or cervix, also becomes thicker than normal so sperm cannot swim into the womb to fertilize the egg. The pill. Effectiveness. With perfect use, only 1 out of every 100 women unintentionally get pregnant. With typical use, up to 9 out of every 100 women may unintentionally get pregnant. To use the pills, you must take a pill every day. The pill. Advantages to the pills are as follows. The pills can make your periods more regular and less painful and can improve the moodiness, fatigue, and stomach upset experienced around the time of menstruation. Also, because the effects of the pills are short-lasting, you can start trying to get pregnant right away after stopping the pills. Disadvantages to the pills are that you may experience some vaginal spotting or irregular bleeding in the first 1 to 2 months of using the pills, and that the pills do not protect you from sexually transmitted infections or HIV. The pill. One common myth is that the pills can cause birth defects. In fact, studies have not found that taking the pills will cause birth defects during future pregnancy or will harm the baby if you become pregnant while taking the pills. Some believe that the pills accumulate in your body and could cause disease or cancer later on in life. The effects of the pills are actually very short-lasting, lasting usually about 26 hours. The pills will actually protect you from ovarian and uterine cancers later in life. Finally, it is a myth that it is good to take a rest after taking the pill for a long time. There is no data showing that taking a rest from the pills is helpful. You may become pregnant unintentionally when you take a break from your pill. The pill continued. Some believe that people may gain weight on the pills. While the pills can change appetite and can cause women to eat more, the pills do not directly cause weight gain. It is a myth that being on the pills for a long time will make it harder to get pregnant. In fact, the pills do not affect your chance of getting pregnant in the future. Women who take the pills for irregular periods may already have a harder time getting pregnant because their ovaries do not release eggs every cycle. A final myth is that pills must be taken at the same time every day. Pills that contain only the progesterone hormone need to be taken every day at the same time. Most pills have both progesterone and estrogen and can be taken every day with 2 hours of wiggle room. The shot. A common brand name for the shot is Depo-Provera. How it works. The shot contains the hormone progesterone and works similarly to the pills. The shot is usually given in the buttocks or arms. The shot. Effectiveness. With perfect use, only 1 out of every 100 women will unintentionally get pregnant. With typical use, up to 6 out of every 100 women may unintentionally get pregnant. How to use. The first shot is given within 5 days of starting your period, then another is administered every 3 months. The shot. The advantages of the shot are as follows. The shot works for 3 months without needing to remember daily pills, can decrease the amount of bleeding during your period, since most women who get the shot stop having periods eventually, and does not affect breastfeeding. Disadvantages to the shot are that you may experience some vaginal spotting or irregular bleeding, it does not protect you from sexually transmitted infections or HIV, and there may be a delay in getting pregnant after stopping the shots. The shot. Some believe that the changes in your periods while getting the shots is harmful. In fact, these bleeding changes are temporary and not harmful. Your periods will usually return to baseline a few months after stopping the shots. It is also a myth that the shots can cause cancer. The progesterone in the shots can actually protect you from ovarian and uterine cancers in the future. The patch. A common brand name for the patch is Ortho-Evra. How it works. The patch has both estrogen and progesterone and works similarly to the pills and the shots. With perfect use, only 1 out of every 100 women will unintentionally get pregnant. With typical use, up to 9 out of every 100 women will unintentionally get pregnant using the patch. The patch. How to use. Apply the first patch on the first day of your period or the Sunday after your period. Replace a new patch on the same day of every week for 3 weeks. Do not use a patch in the 4th week. Apply the patch over an area of clean, dry skin on the shoulders, upper arms, buttocks, or abdomen. If the patch falls off, apply a new one immediately. If the patch is off for over 24 hours, use a backup birth control for 7 days. The patch. Advantages to the patch are as follows. When using the patch, there is no need to remember to take a pill every day. Your periods may become more regular and less painful. You may become pregnant right away after stopping the patch without any delay, and if you forget to remove the patch, you may receive 2 additional days of birth control from the patch. Disadvantages of the patch are that you may experience some vaginal spotting or irregular bleeding in the first 1 to 2 months of starting the patch. Your skin may be irritated where the patch is applied. The patch does not work as well for women who weigh over 198 pounds, and the patch does not protect you from sexually transmitted infections or HIV. The patch. It is a myth that the patch puts you at higher risks of blood clots than the pills. In fact, the most recent post-marketing data shows similar risks of blood clots between women aged 39 years or younger who use the patch or the pills. Fewer than 5 out of every 1,000 women develop clots when using the patch, which is still less than the risk of blood clots during pregnancy. The ring. A common brand name for the ring is NuvaRing. How it works. The ring contains both progesterone and estrogen and works similarly to the pills, the shots, and the patch. Effectiveness. With perfect use, only 1 out of every 100 women will unintentionally get pregnant. With typical use, up to 9 out of every 100 women may unintentionally get pregnant when using the ring. The ring. How to use. When using the ring, you may place the ring into the vagina yourself. Pinch the sides of the ring between your thumb and index finger, insert the folded ring into the vagina, and gently push it up into the vagina using your index finger until just behind the pubic bone. You may also use an applicator to help insert the ring. If the ring feels uncomfortable after placement, you may not have placed it deep enough into the vagina. The first ring should be placed within 5 days of starting your period and kept in place for 3 weeks. Remove the ring for 1 week and place a new ring 1 week after the last one was removed. You should expect vaginal bleeding during the week you remove the ring. You will need a backup birth control method during the first 7 days of starting your first ring. The ring. Advantages to using the ring are as follows. When using the ring, you do not need to remember to take a pill every day. You can place the ring yourself. The ring is one size fits all. Your periods may become more regular and less painful, and you may become pregnant right away after stopping the ring. Some disadvantages to the ring are that you may experience increased vaginal discharge while on the ring may cause vaginal spotting in the first 1 to 2 months, and the ring does not protect you from sexually transmitted infections or HIV. The ring. It is a myth that the ring puts you at higher risk of blood clots than other hormonal birth control methods. The risk of blood clots from the ring is the same as that from other hormonal birth control methods. Another myth is that the ring cannot be reused if it falls out. Even when the ring falls out, it can be washed and replaced. You should use a backup birth control for 1 week if the ring has fallen out for more than 48 hours. Finally, it is untrue that a dislodged ring can get lost in your body.